A very good afternoon to everyone. Welcome to Techignite 2023, organized by NTU College of Engineering. My name is Song Kiat, and I'm an undergraduate student studying chemical and biomolecular engineering in the College of Engineering, and I'll be your MC for this session. Before we begin, do be informed that the session will be recorded and shared on NTU's social media platform on YouTube. So feel free to rewatch it and share this seminar after today's session. If you have any questions during the sharing, you may send them in on our slido.com by scanning the QR code at the bottom left of the screen with the hashtag Techignite, and we will be addressing them later in a Q&A segment. Today, we are honored to welcome our distinguished speaker, Dr. Rex Tan, Chief Technology Officer from Aevice Health Private Limited, to share his adventure to drive medical innovations to transform healthcare, improve outcomes, and empower lives in the new age. Dr. Tan, please.
Hi, everyone. My name is Rex Tan. I'm the CTO and co-founder of Aevice Health. Aevice Health is a startup company spin-off from NTU. We spun off in 2018 from the School of EEE. So without further ado, I just want to share some of the things that we do and why I think this is something wonderful for engineers and scientists to embark in. So Aevice Health pride ourselves in creating the first wearable device for lung health that is small enough that is coin size. So in recent days, I just keep sharing with everyone that Aevice Health's product, Aevice MD, has won the Consumer Electronics Show Best of Innovation Award for digital health category. In fact, I'm now in Las Vegas attending the show, and we just received the award this morning. So I know this session is called Healthcare at Your Fingertip. When this talk title was suggested to me, I thought that was a tall order for any digital health company to achieve, right? In order to have healthcare at your fingertip is really the ultimate goal that all of us are working towards. But are we there yet, or are we going to be there soon? Not quite, but a lot of us are working towards it. I'll start by where the concept comes from. So this is back in 2018. EY and together with the Hospital Association of America has concluded that we need to move towards a model of care called anywhere care, which means that it doesn't matter who you are, it doesn't matter are you rich or are you not that well off. Everyone has to be able to receive care anywhere, and they have to be able to receive care if they need it. And this care includes 4 particular pillars. So when post-acute means when you're discharged from the hospital, you need to receive care outside of the hospital if you need. So we can bring the hospital care standard and quality to home with the hospital at home concept. And a lot of people are suffering from chronic diseases. So chronic condition management is a huge pillar of this venture, because this historically has been the type of disease that patients manage themselves at home, but we have little help. But it's not for long, because digital health solutions are coming up to address this issue. And then lastly, of course, we want to start preventing and start to promote wellness among people. There are a lot of things, a lot of stakeholders that this report has pointed out. You know, technology is a big part of this evolution of healthcare, and I believe scientists and engineers are the key people in this revolution. And if you look at what this report has shown us, in all this, all these circles that you see on the screen, there are different actors and different variables that people that can contribute. And if you take a closer look, all this that have been highlighted can be affected by engineers and scientists because they are technologically based. So we already have a lot of devices that helps us care for ourselves at home, and also receive better quality of the care outside of the hospital. We have smartphone eye imaging technology for our eyes. We have hearing care devices, many different types. We have wearable heart monitors, such as wearable ECGs. We have portable dialysis machine, so we do not need to go to a dialysis center. We have joint rehab wearables for you to do your rehab at home. And now we have wearable lung health monitor, which is Aevice MD. Why am I pointing all this out? Because there are at least one NTU company, spin-off company or NTU research group working on each of this. Now let me get to what my company does. We are looking at chronic respiratory disease. It is the third leading killer of the world. What do we mean by chronic respiratory disease are the like of asthma, chronic asthma, and COPD. If we are in Singapore, we may not appreciate the severity of asthma, but in most of the Western world, asthma is a very fatal disease. And many people are still dying because of the lack of care or the lack of standard of care or do not know how to care for themselves at home. And because of these, 7 people die prematurely due to chronic respiratory diseases. If you just look at the number, more than 500 million people are around the world affected. I just want to use asthma as an example. Poor asthma control is one of the leading emergency department visits and hospital admission in the US, which is Aevice Health's primary market. And not only that, 25% of all emergency department visits are related to asthma. This is a huge number, and it has to be addressed. And it costs the healthcare system here $50 billion a year. So we all can see that this is not a small problem that we are addressing. What we have created here is Aevice MD. It's a care platform for doctors to help manage their chronic respiratory disease patient. Coupled with a sensor, a wearable device, the Aevice MD device. When patient wears them before they go to bed, the device start to record their chest sound and analyze this chest sound for a couple of things. This includes their vital signs, their heart rate, respiratory rate, and symptoms, whether the patient is breathing. All this information forms digital biomarkers that doctors can use to better care for their patients, and patients can use this insight to better care for themselves at home. So how exactly does our device work? I'm not sharing too much in the technical details, but imagine a doctor sees a patient having an asthma attack or a COPD exacerbation. The primary thing that we are looking for is whether or not there's change in baseline vital sign or whether or not they're exhibiting symptoms. The most common symptom in this case is wheeze. It's a sound that you make because when you're struggling for air because your airway is closing. A machine can actually recognize this better than a human because in the frequency domain, there are very specific patterns that a machine can learn to identify. So by exploiting this, our first product, the Aevice MD, that recently won the award, is able to tell respiratory rate and heart rate, measure respiratory rate and heart rate from lung sound recording, and also identify wheezing event. And this is particularly important for the disease progression of asthma and COPD. But also in the pipeline in the future, we're developing capabilities to detect other types of biomarkers that we might be interested in. So for patient, it is a continuous state of measurement. Whenever they wear it, and we suggest that they wear it at night, every night, the device starts to monitor their health. Why do we want to do that? Right now, if you are listening and you have an experience of asthma, I don't wish you to have, but the best way that patients are recording their symptom is literally pen and paper. So you might have experience going to the doctor and the doctor say, maybe you have asthma. We don't know for sure. Here's a notebook and here's a pen. Please note down how you feel every time you feel difficulty. But this is extremely subjective. Why? If I have asthma and I'm experiencing shortness of breath, I wouldn't know that's shortness of breath. My description may be very different from the clinical description. My description may be very different from another asthma patient description. And we expect doctors nowadays to, based on what we say, what we write, to make diagnosis and make treatment plan. This is a little bit ridiculous in my eye because in a lot of different diseases, we already have advanced technology. But for lung health, I think we are one of the first. So our device can detect asthma and COPD exacerbation intelligently and objectively. So doctors can feel safe using this information to make diagnosis and make treatment adjustment. We also can provide this device as a remote auscultation and telehealth system. Many of us become familiar with telehealth now. In Singapore, we can call the doctor and get 5 days MC during COVID-19 period. So we know how to use, we have big telehealth providers. But just step back at a moment. Traditionally, when you see a doctor, what are the things that they would do? Maybe you'll get a temperature taken. Maybe you will have your blood pressure taken. But almost definitely, if you have breathing problem, the doctor will auscultate your chest, it will auscultate your lungs. But when you do this through a telehealth call, all this become not impossible unless you have the equipment at home. But having a stethoscope at home is not enough, right? You need to be able to transmit the stethoscope sound to the doctor. So the Aevice MD also acts as a remote stethoscope. When you have a telehealth call with the doctor, and the doctor realizes that, oh, I need to do a closer examination, I need to listen to your chest. So what you can do is to place Aevice MD on your chest, make a chest sound recording, and send it to the doctor right away, and they can hear you. So we know why this is good for patients. Why is it good for providers, healthcare providers? We provide advanced analytics for their patients' health. We also track the compliance of the medication intake and also their medication regime, very importantly, and we become an essential tool for telehealth. And right now, because of this tool, imagine a pediatrician, a doctor, taking care of 100 asthma patients. When they log on to this device, if all their patients are using this device, right away, in one glance, they know who they need to pay more attention to, because the device will have caught who are more symptomatic and who are actually trending to the worst side. And this will help us focus very precious medical resources and the doctor's time. I'm just giving a use case that we are testing out in the United States. As I shared earlier, United States is actually our primary market. We are pending FDA clearance, and hopefully we're getting within this couple of months. So we know that poor asthma management leads to an increase in emergency visits and admission. Traditionally, now, what happens is when someone comes out of the emergency department because of an asthma attack, again, they are given notebook and pen, because this is as best we have, and we'll have a follow-up visit 30 days later. In this case, the idea of the notebook and pen is to try to capture how the patient feels during the 30 days when they are given medication at home. And if they have any symptoms, they will record it. Again, this is highly subjective. What we want in the medical system is objective data. So what our device can do is, right now, with our partners, when the patients are discharged from the hospital, they are prescribed with Aevice MD. Every night when they go to sleep, they wear the Aevice MD. Aevice MD track their vital signs and also track their symptoms. So 30 days later, if they do come back to the hospital for a revisit, I say do because they may not need to. So let's say if they do come back to the hospital for a revisit, the doctor can use Aevice MD data to see where their health is trending, and also to see when are the symptomatic days. And from there, try to figure out. The interesting about asthma is when someone becomes more symptomatic, it can be due to a variety of reasons. It may not be because the treatment doesn't work. Most of the time, actually a lot of time, is because the patient are not taking their medication. So with our data, when we see patients are trending worse on certain days, doctors can start questioning what's happening, why is this? And this serves as a very important educational point for the caregiver of the asthma patient and the asthma patient that, see, if you do not take your medication for a couple of days, yes, you think you can skip for 2 days, and that's when your symptoms get worse. And that is when from a well-controlled asthma, you begin to become an uncontrollable asthma. And earlier on, I say maybe and if they go for a 30-day visit, because if the Aevice and the symptom log is looking good, the doctor may very well say that, okay, you don't need to come in, we just go for a telehealth visit. And the doctor can call the patient or the patient call the doctor and use Aevice MD as a stethoscope to do physical examination for that particular patient. We also have secondary application that we're testing out. This is a little bit more interesting and a little bit closer to what in Singapore we are doing. So usually when you are diagnosed with asthma, you will follow a pediatrician or a specialist, and they will schedule follow-up visits in between. Your care, it can be a period, couple of months to a quarter, to half yearly, to yearly. In between, again, notebook and pen. There's no innovation in this area for a long time. And from those interval visits, doctors are supposed to tell you whether or not the medication is working. So a lot of time, when asthma patients see a doctor in interval, they will only find themselves taking more and more medication and not less, because doctors will not be able to track whether or not reducing the dosage of medication also provide the same effect of treatment. But this is different with Aevice MD. Say you're scheduled for follow-up visits. In between visits, you can use Aevice MD to provide objective data. When you are visiting a doctor, your doctor can tell whether the last treatment adjustment have an effect on you, whether or not the increase in dosage has a huge impact or just a small one, or whether or not it has an impact at all. That could be a case in this way to help titrate as in adjust medication and adjust treatment on the go with medical insight collected by a medical device. This will solve a lot of problems that a lot of parents are worried, because a lot of these asthma drugs are steroid-based. We don't want the dosage to just keep going up. We want to be able to determine what is enough, and enough is enough. So this is one use case we're testing with one of our partners in the United States. Of course, as a medical device, everybody is very stringent on us. And if you are interested to start a startup in the medical technology field, be prepared to be one of the longest gestation period startup, because in order for your device to go to the market, not only have you have to complete R&D, you have to complete your clinical trials, you have to complete your validation testing, you have to complete your safety testing, and then you can go for regulatory clearance. Safe to say, this is at least a 3 to 4 years experience for any startup founders in the midst of the audience if you want to start a medtech company. But I'm not discouraging you. This is a very meaningful journey, and it definitely will receive a lot of help, not only from the university, but also the ecosystem in Singapore. So for our device, we have validated the accuracy of all our measurements, and they are all within the medical requirement standards. Especially for wheeze detection, we are 92% accurate when compared to a clinician. And to note that this 92% is out of hundreds and hundreds and even to thousands of data. So one thing that is more important, actually not only to medical device, to anyone here looking to create a technology or create a product, create something for another human. Human factor study is extremely important. Just that for medical device, it's also a requirement for regulatory clearance in almost any country, any jurisdiction you can think of. So obviously we conducted human factor study with our lay users and our healthcare professionals. Healthcare professionals are doctors and respiratory therapists in the US. Lay users are 28 patients suffering from the disease in the US. And luckily, actually thanks to our product designer, the device is actually quite welcome by both our healthcare professional and our lay users. Also, just a little bit of sharing here. I was not an expert in human factor study. I was an engineer by training, really hardcore engineering science. When we first started doing this, I couldn't understand why some lay users couldn't figure out how to use our device, because we thought we had engineered it perfectly. So one word of advice to aspiring engineers here is, when you design your product, start talking to your end user way before you think you need to. Again, I mentioned just now, product certification is very, very important, especially for a medical device. This everything. Actually, not everything. So everything we need for Aevice MD in order for regulatory body to even consider our submission, and even for hospital to even consider trying out our device. For different product, that will be different, but naturally, you have to comply with all this. There is also a universal standard, ISO 13485, that any startup or spin-off or company that wants to build medical device have to be complied to, and you'll be audited every year. So what are we doing here? So are we an asthma company, COPD company? Yes, for now, but not really in the future. we have essentially built a stethoscope that records lung sound and send the lung sound to a cloud. And in the cloud, we have a series of algorithms to try to decipher different things. And we call them acoustic digital biomarkers. We can do much more than what we are already doing now. And a combination of these digital biomarkers can indicate certain diseases. So after chronic asthma and COPD, we're moving towards serving the market of obstructive sleep apnea and also lung cancer treatment response monitoring. Well, this company cannot be built by one person. What you see here is are my co-founders, Adrian and Dr. Survey. Dr. Survey was a professor in School of EEE. Dr. Karen is our Chief Strategy Officer. She was a clinician by training. Unfortunately, she's not from NTU. She didn't make a good choice for her school. So, the founding team is not enough. What we also need is people who have the experience, right? So we are quite proud to share that last year we brought aboard our company, David Van Sickle. Dr. David Van Sickle was a former CEO of Propeller Health. Propeller Health was a smart inhaler monitor that tracks how much medication you have taken. And the company was acquired in 2020 by ResMed, a gigantic medical device company for $242 million. So the reason why we bring these people on board, because we want to learn from the success story and hear their advice to how to run our company better and how to reach an eventual state where all our spin-offs are aiming for. Well, this is all just about the founding team and the advisors. It's about building product, running the company. But how do we exactly know what the medical problem is that we are serving? Is to form clinical champions, team of clinical champions. Because our primary market is in the US, we have quite very esteemed specialists in asthma and allergy and COPD in the US, mainly in the US, with the exception of Professor Jennifer Quinn, which is in the UK, also affiliated to NTU because of our medical school. So we form these doctors, we have brainstorming sessions, we consult with them to see what we are building and what's a problem in their daily practice. And that's how we realize that we are actually building a product that doctors want to use and there are patients needing to use them. And that will conclude my presentation. I hope this gives a little bit of insight on what I think healthcare fingertip really means and where medical device company like ours is heading to and trying to contribute to the evolution of healthcare. And I gave quite a thorough run through of what our company do, what our product is, and how we started, why we built it. I'm happy to have a discussion after this with Prof. Leong, and if there's any questions, happy to answer them.
Thank you so much, Dr. Tan, for your sharing. I'm sure our audience has many burning questions after listening to the sharing. We would like to bring your attention to the QR code at the bottom of the screen. To the audience, you may scan the QR code and it will direct you to slido.com, where you may input the hashtag Techignite to post your questions. For our next segment, I'd like to invite Nanyang Associate Professor, Professor Leong Wei Lin from NTU School of Electrical and Electronic Engineering, who will be joining Dr. Tan for the Q&A session. So a very warm welcome to the Q&A panelists. And let's begin to address some of the questions that the audience has sent in. So for our first question, I believe this question is directed to you, Dr. Tan. And the question is, moving forward, smart health systems will leverage AI technologies to achieve operational efficiencies and experience. Could you share with us what are some medical areas Aevice is looking to venture into, and how can engineers play a pivotal role in this?
So what I shared just now is our device is trained to recognize different symptoms, different biomarkers a person may exhibit. But this is just simply recognizing symptoms like just a human doctor would do. But we can go further to help doctors deliver healthcare more effectively. And one way to do that is to create a clinical decision guidance system, clinical decision support system using AI. So when we start, we have already started collecting patient data. And if we have sufficient patient data, we can start to classify them into different risk classes. And now we can start advising the doctors who they need to pay more attention to, who are doing generally okay. So this, I believe, for any type of medical devices, if we are able to do that, to integrate into a clinical decision support system, will really ride on the capability of computers being able to crunch a lot of data to help doctors make better decisions. But of course, engineers and scientists cannot do this alone. This has to be in collaboration of the clinicians, because we are not disruptors of how they practice medicine. We are enablers to help them evolve the way they practice medicine. So I think this is one way Aevice Health is going towards, and I cannot share the collaborator, but we are talking to a very important institution in the world in medical health to work on such a system.
Thank you, Dr. Tan, for your sharing. So for our next question, I believe this question is more directed to you, Prof. Leong. And the question is, could you share with us more about your experience in semiconducting and working with bioelectronics and how it can transform our health system in the coming years?
All right, thank you for the questions. For me, my experience are actually quite different from Rex. So what I do for my research is that we work on next generation organic materials, which actually had the features of flexibility, printability, and biocompatibility. So what we are looking at are materials and devices that we can print them, that have good interface with our skin tissues, and we are trying to make into an electronic skin-based electronics. So again, these are quite relevant to what we are aiming for the future generation of wearable sensor. So these are the things that I am trying to work on, which are still not in the market right now. So hopefully it will transform in future to benefit for the health industry.
Thanks a lot, Professor Leong. I do look forward to how your products can be implemented into our future health system. So for the next question, this question is directed to Dr. Tan. And the question is, the Aevice MD is an innovative product that brings healthcare to our fingertips. Could you perhaps share with us how it will be accessible to consumers at an affordable price?
So this is actually a very tricky question, because the answer depends on which market you're looking at, because every country pays for healthcare differently. So I think company like us need to be a little bit more flexible when we look at business model and revenue model from different countries. Give an example. The United States has a quite comprehensive insurance kind of a framework set out. A lot of devices that are being used and treatment procedures that are being used for the care of the patient, so long you achieve good result, can actually fall under different claim codes, right? So in the US, it could be the case whereby we rent the device to different patients for the period of time they need. And for example, the doctors can charge them by a subscription fee or a rental model, and for us to charge the hospital as a subscription fee. So in those ways that we can try to lower the cost as much as possible, but I think we still have to grapple with the fact that there will definitely be price disparity across different markets, even within the same market in different segments. So I think one of the things that is fortunate is the tech giants that they flourish in the last 10 years. So hardware prices has been suppressed. If you can be creative as engineers to use lower cost components to build our product, that would definitely help make healthcare more accessible through technology.
Thank you, Dr. Tan. For the next question, early on, you mentioned that you were a hardcore engineering student back then, and when you first joined Aevice, you had somewhat quite a rough time trying to understand certain medical terms or understanding. But fortunately, you had really awesome and great partners that you could work with and share your experience with. And so this question is, as an engineering student, specifically from the electronic engineering school, how can one get exposure in a medical or health-related industry?
So I wish someone would have told me this many years ago. I graduated quite long ago. So I actually spent 8 years studying engineering for my undergraduate, also for my PhD. During that time, we learned how to create stuff. We know how to build stuff using our engineering knowledge. But it's very seldom it comes across our mind, who are we building for? We think it will work for them. We think it will be perfect. It may not be when the actual person who is going to use it touches it. So when I joined this company, that becomes something that is challenging for me. If you want to gain insight on how MedTech design product and start building product, engineer product for our customers, for our patients, so that they use it safely and effectively, I highly suggest that you take an internship, be it your first or second or third, doesn't matter, during the summer. Look for a local MedTech company or even an overseas MedTech company, preferably a startup. Join the team, look at the pace that they work, and try to absorb how the different functions within the team works. We definitely have a designer, we definitely have an engineer. These are two of the most important roles in designing the product. And if they, for lack of a better word, screw up and do not think of human factors, the product is not going to be safe and effective for patients. So the best way is to put yourself in this company, in this team, and see firsthand. And the one caveat, not caveat, I think one cherry on top is if you work for a startup, most likely the team is very small. You'll get to see the entire operation from the start to end. You might be able to even own a piece of development for yourself within the product line. So that's something that I hope someone told me. I did not go to a startup company to try an internship. So when I start my first company, it was really a shock.
Thank you so much, Dr. Tan. That sharing was indeed insightful. So for the next question, this question is directed to you, Professor Leong. And the question is, could you briefly share with us if the NTU EEE curriculum offers any in-depth courses or research projects that allow students to be exposed to virtual health or the use of technologies such as apps, wearable and environmental sensors, since digital health technologies is becoming integral to our health system?
Okay, it's a long question. So I will actually break this question into several parts. So for our EE school, right, in our first and second year, we actually really built the EE foundations. So we have courses that really build your foundations, such as digital electronics, also on semiconductor devices and processors. So these are really hardcore EE subjects that you have to learn to master it. And subsequently, right, once you have that basic foundations, we also have the DIP, the Design and Innovation Projects in our third year, where it's a group project where students will come together to actually build smart apps, smart devices. And these are the things that will start to make you have a lot of hands-on skills and able to build things from scratch. And we also finally have our final year projects. These are projects which is 1 year long, where you have maybe branch into research project base to build your sensor, to also have a mobile apps, etc., depending on the project scope. And in our final year, we also have the final year specializations. So specializations is where you really specialize into biomedical electronics, microelectronics. So I would say our EE curriculum are quite diverse. But from the first year to the final year, we do give you exposures so that you can have exposure to all the digital health technologies.
Thanks a lot, Prof. Leong, for the sharing. So for our next question, this question is directed to Dr. Tan. And the question is, how did your engineering experience and knowledge help you in your career? And what are some takeaways you would like to share with our students? So Dr. Tan, perhaps you could also share with us things that are beyond what you actually study from textbooks. Maybe something more like what are some of your personal philosophy that got you through tough times, something that you can share with our students?
So first of all, if you enroll as an engineering student, you are trained to solve problems. Be it for your career or your life, there's definitely useful skills. Being able to analyze a problem and start to think of a solution right from the first principles, that is something that is valuable that I'm going to bring to my entire life to grave. So this is something that helps me not only in my career, but also in my life. I think I have two parts of my engineering education, right? So my undergraduate is pretty diverse. We only specialize in the last year or the two last years. So we get quite exposed to a wide range of general engineering, general electrical, electronic engineering. That is very helpful because if you look around you, any gadgets, any electronic gadgets that you see, it's not just made out of one engineering field. It's not just hardware. It's not just materials. It's not just app, it's not just AI, it's a combination of everything. So I found this to be extremely useful exposure that I have when I started working on Aevice because this is a product that touches AI, it touches hardware, we have to design circuits, we have to, even couple our electronics to the acoustic on components. There's a lot of different engineering fields. I'm not an expert in most of them. My specialization for my undergraduate gave me some expertise in some. My PhD gave me quite a lot of specialty in one particular area, but it is actually the broad exposure that allows me to be, in a way, an engineering manager or a technology manager to pull together teams to build this product. I'm able to identify what are the things that I need, what are the people that I need, what are the things that we need to do. Then we go and find resources to do it. So appreciate the opportunity to learn a wide, and not really learn, but to be exposed to a wide range of engineering field. They can be useful and can be very, very useful, especially you take a career like mine. So along the way that I built this company, it's been almost 5 years, 4.5, almost 5 years. It's really, really, really tough. Right, so I think engineers sometimes are a little bit weird. We like to solve tough problems. If the problem is too easy, I don't think we feel like we earn the money too easily. So I guess as trained as an engineer, we are kind of quite the right group of people to start a tech company, to understand the ins and outs. If you bring this kind of mindset into your career, I believe it will help you thrive in almost anywhere, be it your future career is in engineering or not. Not sure if this is a good thing to say, but engineers are even wanted by banking and finance, by any industry that you can think of.
Thank you, Dr. Tan. Prof. Leong, would you like to add on also on your personal experience that you would like to share with the students?
Yeah, I agree that we need to be well-rounded. Sometimes just knowing something about a specific field is can actually give you a bigger perspective. So my advice is don't be afraid of trying new things. So even though you are already your mindset is I need to do AI, I need to do this and that, be open and willing to try different new things that may actually give you a wonderful experience also, and who knows, it may be helpful for your future work also.
Thanks a lot, Prof. Leong. So personally, I have a question to ask both Dr. Tan and Professor Leong. So currently, it's a new curriculum that NTU introduced, the ICC modules. And recently, last semester, I took a module known as the ML004, Career and Innovative Enterprise for the Future World, where they encourage NTU students to adopt an entrepreneur mindset in hopes that we can be entrepreneurs in the future. So as a current engineering student, if I would like to venture into an engineering startup, would you suggest, or perhaps based on your personal experience, would you suggest that I pursue a higher level of learning, such as pursue a master's or PhD, or should I work as an engineer in a company outside, gain a couple of years of experience, then carry on with my startup, which is what you would recommend? Perhaps I could hear from Dr. Tan first.
Okay, this is a really tough question. No one says that you cannot start a company while you are a graduate student. So that is one option that I would go. So and also I think it's really it depends on people. My own personal opinion, there's two ways to start a tech business. One is you try very hard to find a solution. And when you work on a solution, you try very hard to find a problem to solve. or you have a problem and you just go by the flow using your engineering skills to solve that problem with a solution. So if you know that at some point you are able to identify a problem, you can begin to assess whether or not you really need that postgraduate education. Well, of course, I have done a PhD. I will encourage anyone to go through it. It's an experience like none other. You will not find similar experience in anywhere in your career ever. But it's not 100% necessary. It really depends on what's the problem you're trying to solve and what are you passionate about solving. So I just shared a little bit of personal story. My co-founder was an asthmatic child, so he has real passion in bringing this device to help to help asthmatic children around the world. When I looked at this technology, I saw something that was in the lab and it wasn't commercialized, and I thought, this is a little bit stupid, right? So if that's the technology that I know can eventually benefit people, it's just that there's no one bringing it out. That became a motivation for me, because I know as an engineer, training school of EEE in NTU, I have the skills to bring this into a product and bring it to the market to start benefiting people. So it really depends on what your passion is and how you feel about the technology, or whether or not you know enough about a problem that you want to solve. So I would say in that way, it really varies from people to people. There's no requirement for you to be a postgraduate just to start a company. There's a lot of companies spin off NTU. There's no postgraduates inside.
Thanks for sharing, Dr. Tan. As for Professor Leong, do you have any inputs that you would like to add on to what Dr. Tan have shared, since you have spent quite a good amount of time in the research sector, and right now you are a professor lecturing students in NTU?
Yeah, sure. I would say it really depends on the timing and the opportunity. So if you really have a good product that you want to push through, for sure, you don't need to go through your master, your PhD to do it. And the team also. So if you have the right team, your CEO, your CTO, etc., are already being assembled, and then you should go for it. So but having a master and PhD are something that I am passionate about, because always trying to discover new things through research are things that are that my in my own experience is what I'm happy about, and is what I'm looking forward to. So these are all different things that you have to weigh. So there's no really no right or wrong decisions. Yeah.
Thank you, Prof. Leong, for your insightful sharing. So to summarize, basically, Dr. Tan and Professor Leong, you have both shared that we should not, as engineers, we should not limit ourselves to just one sector just because we are studying this particular subject in university. For Dr. Tan, you took EEE back in university all the way to master's, to PhD, but right now you are serving the healthcare sector. And as for Professor Leong, although you spend a lot of time in the research in other sectors, right now you are doing on a researching a product related to healthcare, even such as wearable devices. Yes. So thank you so much, Dr. Tan and Professor Leong. We have now come to the end of the Q&A segment. So on behalf of Techignite and NTU College of Engineering, I'd like to thank the panel once again, Dr. Tan and Professor Leong, for all of your insightful sharing. And thank you to all of you who have sent the questions in. We hope that today's session has ignited your interest in bringing digital transformation into the health and well-being field through engineering and technology. Do also follow our NTU Techignite website and our official Techignite Instagram to get updates on such events. Do also remember to scan the QR code to get latest updates on our Techignite events. We have now come to the end of today's Techignite session. Thank you so much once again for your attendance, and we hope to see you soon.